Tonight's moderators are Dr. Anand Kumar Katiar of India and Dr. Ronnie Torres of the Philippines. Dr. Anand Kumar Katiar is an assistant professor of surgery and consultant surgeon in Command Hospital, Udhampur, India. He also has a fellowship in trauma surgery and critical care, JPN Apex Trauma Center, All India Institute of Medical Sciences in New Delhi. Dr. Ronnie Torres is Consultant General and Trauma Surgeon at the Nueva Ecija Good Samaritan Health System, Incorporated in the Philippines. He is a board member of the Philippine Society for the Surgery of Trauma, a hospital administrator for the Nueva Ecija Good Samaritan Health System in Gapan City, Philippines. Former head of Section Trauma Surgery, Dr. Paulino J. Garcia Memorial Research and Medical Center in Cabanatuan City, Philippines, and a former medical director, Immaculate Conception Medical Center in Cabanatuan City, the Philippines. Joining us from India, Dr. Anand Kumar Katiar. From the Philippines, Dr. Ronnie Torres.
Good day, participants of the Asian Collaboration for Trauma Forum. To start, the chairman of the Asian Collaboration for Trauma will give his opening message. He had his training in orthopedic surgery at the Armed Forces of the Philippines Medical Center, 1994. He was sent to the US and PGH in the final years of training as resident scholar by the American College of Surgeons for spine surgery. He served as a regular officer in the Medical Corps of the Armed Forces of the Philippines, 87 to 2000. He served as medical specialist and training officer in the Department of Orthopedics of the Dr. Paulino J. Garcia Memorial Research and Medical Center. He also became the Assistant Provincial Health Officer for the province of Nueva Ecija. He had his master's studies for hospital administration at the University of the Philippines, year 2000. He is a fellow of the Gregorio T. Singian Leadership Society. He is a member of the Integrated Military Partnerships and Civilian Trauma Systems Study Team at the program in Global Surgery and Social Change of the Harvard Medical School. Member of the editorial board of the Journal of Acute Care Surgery, member of the Education and Social Media Work Group of the Journal of Trauma and Acute Care Surgery, board member of the Philippine Red Cross, Nueva Ecija chapter. He is fellow and member of many national and foreign societies of orthopedic, spine surgery, and trauma surgery. He is the chairman of the Schola Christi Foundation, a Catholic institution in the Philippines. Fellow learners of trauma surgery, let's welcome Dr. Rolando de la Cruz.
Thank you, Ronnie, for that kind introduction. Dear colleagues and friends of the Asian Collaboration for Trauma, greetings and welcome to the 13th ACT Interactive Virtual Encounters. The title for the webinar today is Playing the Field in War and Disasters, Essentials in Planning a Humanitarian Response. We will be discussing the basic knowledge that a medical missionary or humanitarian responder need to possess before deployment in the battlefield or natural and man-made disasters. Foremost among these is a knowledge of the epidemiology of injuries in war and disasters. What are the causes and mechanisms of injury? What body parts are involved? The severity of injury? What are the treatments done in the past? And whether these treatments have been effective or needed to be modified. Another concern are the core competencies of each and every responder. They have to possess the basic knowledge of emergency measures, damage control, and all kinds of resuscitation and life support. The third area of concern is the management of mass casualty incidents, where the principal triaging is applied. And of course, one needs to know the ethical issues about the conduct of humanitarian response. We need to know something about the international humanitarian law and the Geneva Convention, how to treat injured enemies and prisoners of war. And so today, we have some of the world's brilliant trauma surgeons who would attempt to answer the predicaments that we posted. Dr. Irene Madrid, a battle-tested trauma surgeon from Marawi City in southern Philippines, the epicenter of the Marawi siege. Dr. Amir Koram Manesh from Sweden, who will discuss training of physicians and healthcare workers prior to deployment. Dr. Miklos Bala from Israel, who will talk on the management of mass casualty incidents, and Dr. Daniel Masokin, a very prominent ethics teacher in Switzerland. We are also delighted and thankful to have an illustrious panel of reactors composed of Dr. Mahanama Gunasekara, Dr. Pawan Sharma, Dr. Ted Herbosa, and Attorney Dr. Joel Macalino. They will be properly introduced later. Moderating for today's webinar will be Dr. Ronnie Torres from the Philippines and Dr. Anand Katiar from India. Thank you, Dr. Ronnie and Dr. Anand. The active webinar has more than 7,000 participations to date, with an average of 545 audience per webinar. Together, through hard work and perseverance, we were able to overcome the obstacles brought by the COVID-19 pandemic and deliver to our fellows and friends the highest quality of trauma education that is a very important tool in the care of our injured patients. And for this, my deepest gratitude goes to the lead organizers and industry sponsors, without whose help this webinar would not be a success. They are all credited for setting up these webinars, and I am so grateful for their help. I would like to acknowledge Dr. Chuming Turk, our Scientific Program Director, Dr. Amit Gupta, the Education Committee Chair, Dr. Raj Menon, the co-chair of the Education Committee, Dr. Amila Ratnayake, our Research Committee Chairman, Ms. Cathy Mayor Carpio of ADP Pharma, our industry sponsor, Ms. Geng Libunao Rodriguez of Highland Valley Resort and Villas in Pantabangan, Nueva Ecija, Ms. Rins Lynn Higdan, Ms. Vanessa Manuel Atienza, and Mr. Roger Michael Gol de la Cruz of the ACT Secretariat. We have now 240 fellows in the Academy of the Asian Collaboration for Trauma, and we hope to grow bigger and stronger during the coming year. To all the fellows, your organization is committed to providing you with the highest level of education, training, and research. As your chairman, I am truly excited and privileged to serve you all, and I am looking forward to a more fruitful collaboration in the future. Thank you, and please enjoy the webinar.
When bad things happen, nobody anticipates it, but are you prepared for it? 4 international speakers and 4 reactors had talked about how to prepare and respond to such an eventuality. And of course, this pertains to war and its eventualities. I hope that you have learned from the actual experiences of these speakers and their commentators. We also hope that you will not put into practice what you have learned from this webinar, but you will never know. The next webinar covers civilian terrorism, something that we all prepare for, but we hope will never happen. But history has taught us that it does happen, and it happens when we least expect it. So, how does a country prepare for it? Even the most peaceful country with very strict laws, gun laws, and the most idyllic holiday destination with many tourists are not immune to it. So we have to learn. Unfortunately, most of it is learnt through history. The Norway terrorist attacks, the Bali bomb blasts, in Israel, where terrorist attacks are part and parcel of life. As has been said before, it's always better to learn from someone else's experience than from one's own personal experience. So learn we must. So good night to some, good morning, and good afternoon to others. Thank you.